The Western Cape government says it's in talks with national government to exempt more healthcare facilities from the rolling power cuts. Health Minister Dr. Joe Phaahla announced this week that 3 hospitals in the province, Tygerberg, Groote Schuur and Red Cross War Memorial, had been exempted. For more on this topic, we're joined by the Western Cape Health Department's Chief of Operations, Dr. Saadiq Kariem. A very good evening to you. Thank you so much for your time. Some strides being made to ensure that hospitals are exempt from load shedding. Of course, it's been a really imperative move to make, given the reality on the ground.
Absolutely. I mean, we've always had Groote Schuur, Red Cross and Tygerberg. Those hospitals have been exempted from load shedding for quite some time, and that's been by arrangement with the city of Cape Town. But in addition to that, we've seen a significant impact on all our hospitals throughout the province, in fact, throughout South Africa, I would imagine. And as a result of that, we've requested that 19 additional public sector hospitals are also exempted from load shedding. And these are really hospitals that we've selected because they have high impact. These are high impact acute hospitals that are strategically located throughout the Western Cape province. And so those hospitals we've requested to be exempted from the load shedding.
And when it comes to the considerations that need to be made, we also understand that hospitals, including Mitchell's Plain, the Marlborough Maternity Hospital and the New Somerset Hospital, are also on that list to be prioritized.
Absolutely. So we've obviously, these are very difficult choices that we had to make in order to determine what that list of priority should look like. We've got roughly about 56 acute general hospitals in the Western Cape, and we had to select from that list the hospitals that we'd like to put forward. And in order to understand some of the impact, what I mean by high impact, so we looked at, for example, the workload of the hospitals. Generally, most of the hospitals on that list are running at 100% or often above 100% in terms of occupancy, which is how we sort of measure workload. But we also considered factors like the burden of disease. We considered the geographic spread right across the Western Cape. And we also obviously looked at the range of clinical services that are offered by these hospitals. So a hospital like George, for example, sits very far from the metropole, but they often offer tertiary services at George Hospital. And so we considered those criteria in putting forward that list of 19 hospitals.
Of course, George Hospital has been switched back on shortly after the press conference that we saw yesterday. Talk to us about that.
Yes, I mean, that was really, and really just want to say thank you to the George municipality for their incredible responsiveness. So following yesterday evening's media announcement by the minister and our HOD, Dr. Groote, George municipality responded immediately. And in fact, during the load shedding hours that George had, they switched the hospital back on to the power grid. And we were really quite grateful for that. And it makes a significant difference to our patient care that we can provide at all our hospitals.
Minister Joe Phaahla, as he was giving that press briefing yesterday, he spoke about some of the cost implications that will need to be considered within these talks, saying that he'll have to speak to provincial government to sort of determine exempting the areas which will come at a cost and all those adjustments. How are those conversations moving, and what considerations would you have to make as a department?
Obviously, we understand that it's difficult to isolate the hospitals from the rest of the grid and from the rest of the economy. And we understand that it's quite a technical exercise. We're busy engaging with that exercise. But just to give an indication of the cost that we're spending as a health department since April 2022, and this is to keep our generators going. So we've obviously had to spend additional costs on fuel, on oil, as well as medical gas to make sure that we can run our theatres, our ICUs, etc. We've spent as a province since April 22 to date just over 53 million rand just to make sure that the generators can function. So we understand that there's a cost to the economy, but there's also obviously costs and expenditure that we have to incur to make sure the generators run and function adequately.
Let's talk about what moving ahead and ensuring that these healthcare facilities are indeed exempt from load shedding, the broader picture on what it means for day-to-day operations, especially looking at the backlog when it comes to really crucial surgeries that need to be made?
Definitely. I mean, this obviously will have an impact on the backlog of not only surgeries, but also backlog on just medical care. And I mean, obviously, it's important that we make sure that we can provide all surgical services, such as cancer treatments, radiotherapy treatments, etc. I mean, in the Western Cape, we've had a specific program trying to catch up with the backlog of elective surgeries that have had to be postponed as a result of COVID. I mean, at the moment, for example, our current waiting list and backlog is already at around 77,000 surgeries across the province. These are the operations that are longer than 30 minutes, but also what we call minor operations. The combined total of that 77,000 surgeries in terms of the backlog. And we're obviously trying to catch up with that backlog, and we've got a program to catch up with that backlog. And we are concerned that the load shedding and the impact of the load shedding will just set us back even further.
So when it comes to, putting deals on paper and ensuring that this process moves ahead with some sort of pace, where are you standing there?
So we've been engaging with the municipalities and obviously with Eskom. And we have a really good working relationship with our City of Cape Town colleagues as well, and now recently with the George municipality. But we really are engaging with all the municipalities, and I think the first exercise is in the sense to understand how integrated the hospitals are into the grid, so that they can be isolated. And those discussions we've already engaged with Eskom and with our municipalities to try and come to an understanding of how these hospitals can be isolated. And we hope to conclude that quite quickly, because this is obviously quite urgent for us. And once that technical work's concluded, we'll be able to determine which of the hospitals can be isolated off the grid, both off the city grid for the Cape Metropole, but also for the Eskom grid for the rural areas.
In Johannesburg, City Power yesterday spoke to some challenges that come with this process. They're saying that in terms of, having more staff members and roping in other parties to come and assist will be something that will be needed in terms of personnel and operations. In your conversations with getting the process rolling, what are the challenges that you've encountered in terms of the logistics of ensuring that the health facilities within the broader list are exempted?
Yes, I mean, we've got an emergency electricity response team, and some of those challenges obviously are in the sense of particularly, I think, the medical equipment that needs to keep running. And we need to make sure that our generators and the technical infrastructure keeps running. We're fortunate in the province that we've got a fairly stable staff complement. And we've got a really good team of engineers who are part of that emergency response team. And our emergency medical services colleagues are also part of that. So from a staffing personnel perspective, we have enough people to be able to make those assessments. But the impact for the province really is mostly around the equipment. And obviously with these power surges and with all the electrical, technical electrical issues that need to be resolved, that's going to be an impact for the province going forward. So we really need to make sure that the generators function, that the equipment is maintained properly, and that the power surges and load shedding doesn't damage what's very expensive equipment that amounts to tens of millions of rands.
Absolutely. Thank you so much for that update, Dr. Saadiq Kariem, Chief of Operations in the Western Cape Health Department, speaking to the decision of some of the hospitals that were exempted from power outages within the Western Cape.